Hey, Dana, can you get Kiara down here for me? She isn't answering her Spectral link.
She's not working today. I forget. I'll find out and get him down here. What else you need?
How about a double espresso?
I like the way you think. Dylan Easton is covering for Kiara this weekend. They're on their way down. Maria? Well, 11's made a mistake. Tread carefully, Missy.
He's in a gown in South 21. Is there someplace we can get this laundered?
Those are going right in the incinerator. We'll get him a whole new wardrobe. You ever used a cast saw before? Of course you haven't. Well, today's your lucky day. Follow me. Dr. Mohan, you got a minute?
Yep. How long's the cast been on?
Months, maybe years. Probably gonna want to breathe through your mouth. All right, Mr. Digby. Okay, this cuts the cast, not the skin. This should relieve the itching. Cast spreading. Hastings?
Evans,
Hope you know what you're doing.
what is that supposed to mean? I'm a big girl.
Okay, big girl. Pharmacist mixed up phenylephrine, 10 cc's of 100 mics per cc.
Great, that's the maximum.
Send to catch whatever they pull out. Got it?
I think so.
Holler if you need me. Waiting on Pete for baby Jane Doe. Central 6 is sitting pretty with his insulin drip, and the Westbridge diversion to sit for ours in our lovely holes.
You are some kind of savant.
Worthy of a race?
Just more of my love.
Not enough of that.
I'll take care of it.
Sexual assault victim in triage. One of you needs to hold down the fort.
We can call for a sane.
On a holiday, it'd be ours. We're not going to make this patient wait. And since habits, come on. You ready, Doc?
Sure.
A sane is a sexual assault nurse examiner. We do forensic exams, collect evidence, and hand it over to the police if a report is made. We also provide resources, support, sometimes even testimony.
You go to court?
Saints are very valuable in a hospital, especially in ED. More nurses should train for it.
It's a not so subtle hint.
What's going on with Westbridge? I got 20 on lanternflies.
Nope, nothing.
These patient passports have an interesting alternative use.
Where's the sexual assault victim?
She's in triage chair 2.
Thanks, Lupe.
Here's her intake.
Got it. Hi, Miss Miller.
Been better.
Yeah. You're in a safe place now. I'm the charge nurse in the ED and a sexual assault nurse examiner. This is Emma. I'll be assisting.
And good.
We're gonna get a room ready for you. Meanwhile, Dr. Alishim is gonna ask you a few questions.
How long is this gonna take?
I can't promise an exact time, but we'll try to be as fast as you need.
Thank you.
Yeah. Exam rooms 1 and 2 for this. It's the most private space we have away from the ED. All right, this can be a lot. You up for it?
Yeah? Yes. I'm good.
All right, let me know if you need to step out. Find another place to lay your head.
30, I'm
No, we're getting Westbridge diversions. And chairs is insane. Didn't you see out there?
Ew.
People sleep in here?
Yeah, night shift doctors need rest, especially if they have to come in during the day. But today we can't waste the space. I need you to get me a stool on wheels and Esme for a turnover. Okay, you can have a seat. Control now, Alana. We're here to help and support you. Once I open this kit, I cannot leave the room. But if you need a break, or with you if you like. Action against rape has been called, and they should arrive. Face shield on so don't contaminate anything. Emma's already done the same. Now, in order for the doctor to do her exam, Emma's gonna be behind this curtain, and I'll be in here with you. It's bruising.
Over the shoulder. Okay. Dana will finish up her work, and I will be in.
All right, Alana. I read your intake. Why don't you give me your description of exactly what happened? Evidence envelope with everything else. I'll swab it with a wet, then dry Q-tip. Is that okay?
Yeah, sure.
All right, everybody, settle down. Good. Now, Robbie, I'm gonna write all this down.
Dr. Mohan.
Medication orders aren't coming.
To the bedside, not to hold charge. Same goes for nursing notes. What does that mean?
You can check the manual.
Ah, So the rash in North 3 has been discharged. The tasered law student in Central 10 has gone up to psych. The eye stroke is now in the ICU, and the tongue laceration in South 15 is sobering up before we discharge. It's better be soon, because we need the room.
Okay, I'll grab a med student and get more patients moving out.
Are you not fazed by any of this chaos? What a fucking mess. Jesus Christ, we need you. Monica Peters, this is our new attending, Dr. Alashimi.
Welcome.
Thank you.
Monica's a retired clerk, best of the best. She was kind enough to come in on a holiday and help get us back into shape.
Laid off by the digital revolution, not retired. And how's all this digital shit working out for you now?
Also good.
Exactly. All right, then. Who's handling the charts and the orders?
That's us right here.
Princess is looking for you. There's something about Monica under her breath, but I can make it out.
Okay, I'll be back in a sec. Hey, hey. Did good with that sexual assault victim. They provide the best care to traumatized people in their darkest days. Smart. It's a cyber tax? Yeah. But you're only a few hours away from being done with your first of many. Be proud of that. Got a gun ban? Thanks. Keep losing these. Oh, this fucking day.
Thought I was gonna get a clean getaway from a trip.
God gives his toughest battles to his strongest soldiers.
Dana, is there a...
Nice to meet you.
You're Dr. Robbie? Cool.
Central 7 was just cleaned. Anything I can get you, hon?
No, thank you.
Oh, wait, Becca, come here. Come this way, we're going right in here.
Oh, where can we get that?
1988. You ever seen one of these?
Honestly, no.
How are we gonna get labs and x-rays to the wards?
The old-fashioned way. Renters.
I'll check if they can spare a couple clerks from upstairs.
What's all this?
I brought radiology to us.
Cool. He's taking up a lot of space. What lady?
I just tried to put a hematuria patient in there, but it's occupied.
South 22, you sure?
I'm positive.
That's my patient.
Then why isn't she on the board?
She should be. Olive was bringing her back from triage. I picked her right up. I just assumed she made it to the board.
You should have checked. You should have made sure.
I haven't put anybody on the board. I thought the nurses did that.
We all need to pitch in. There's no rooms at the moment. Put hematuria on the wall. Who's your patient?
Mrs. Burns with nausea.
You too. Make sure. Triage could use an extra hand. Princess, finish up here, then head that way.
Three for CT now. Should I run it over?
No, keep taking off orders. CT's gonna get backed up if we wait on these.
I know, but I can't waste a runner on that right now.
Where'd you find a carrier sheet?
Exactly where I filed it away 10 years ago.
I thought that thing didn't work.
Can't receive, but it can't send.
Good morning.
It was a good morning. I'd still be in bed.
So what are you doing here?
Benji's mom is visiting for the holiday.
She's still alive?
Well, it was too mean to die. Plus, who else is gonna get this place through the 4th of July weekend?
Sure as hell ain't gonna. The prodigal.
Too soon. It took some time. Like an old trail horse, always found a way back out. You look good, kid. How you feeling?
It's been,
But if you hurry back, you can catch some of the pass-ons there in North.
thanks.
I'll keep an eye on him.
A lost little lamb. I'm Lena. This is Dana. I'm night shift going home, but Dana is queen of the day shift.
I'm here to shadow.
Welcome to the Pitt, Emma Nolan. Here, let me put some of your stuff behind the desk, and I'll give you a quick tour.
Okay.
Where you from, sweetheart?
Sault Ste. Marie. It's in Upper Michigan, practically Canada.
My great-grandmother was from up that way. Nice area. A lot of bugs. How about a couple important rule around here? Be smart. Use the STAMP acronym to assess patient.
M is mumbling.
If you listen closely enough, it's often them saying what they're thinking of doing as they talk themselves up to it. And P?
Pacing.
Good. We also have a safe word. Hula hoop. I guess technically it's 2 words, but whatever. If there's a threat, say hula hoop, and we'll all respond.
Yeah? Lovely. Okay, I'll be right there with reinforcements. Duty calls. We're headed for triage.
Donnie Donahue, nurse practitioner. This is Emma, new grad nurse.
Hey,
Nice to meet you.
What's going on?
somebody dumped their kid.
Maybe Mom just stepped out for a smoke or something. What? I'm being hopeful. Sometimes they just need a little break and then they come back. At least I didn't leave her in a suitcase at the bus station.
Does that happen?
If that's a true story, I don't want to know about it.
The worst I've seen.
Please don't tell me. I'm a new dad, remember?
On the other hand, though, I am known to be a bit overly sensitive sometimes.
Mal.
And yes?
You're talking to yourself again. You need something?
Yeah, good lawyer. I don't know. I'm kidding. I'm.
Yo, Rabinovich, somebody ditched a bundle of joy in chairs.
How old?
A couple months, maybe Donahue's got her in peds.
No one saw who left her?
Apparently not.
It's so sad.
Tell me about it. Who throws away a perfectly good baby?
Make a lane.
Sweet baby Jesus, Antoine. Right to the outdoor shower.
I just drive them. I'm not a wash and detail service.
Yeah. God forbid you prove useful. Good timing, Miss Emma. Time for you and me to do the Lord's work this way.
Oh, God. What is...
I'd offer you some gum, but it's laced with nicotine. Trying to quit smoking.
That's good.
Verdict's still out. Getting all those nooks and crannies, Mr. Digby. Your skin will thank you. We all will.
I could stay in here all day.
A miracle what a little soap, water, and human decency can do sometimes. Don't forget the ears, pal. Don't want anything growing in there either.
Okay.
So what's your story, Emma? What do your parents do? Got siblings, boyfriend? Ever kill a man in a bar fight? Doctor is an idiot. Just checked on baby Jane Doe. Looking good. Taking formula well.
We're here to take a statement. We're looking for a Tony Chincholo.
Yo, right over here, boys.
Come in.
Hi. Heard your patient took off.
She's taking a little break.
How long are you gonna wait? You know about the cyber shutdown thing?
Yeah. Wish I could help, but I'm gonna stay here till all the evidence is collected, so.
It's a hot mess out there.
This whole day is. I'm glad to hear it. Did you get something to eat? Okay. Yeah. 2 swabs from the cervix. Each swab gets labeled. First vaginal, second vaginal. Smear slide with both and let it air dry.
Same for the cervix?
Yeah, but no slide needed. How you doing, Alana? Almost done.
I can help with that.
No, it's gotta be me. I'm gonna pull this.
Done?
One last thing. 4 more swabs inside your mouth.
Didn't you do that already?
Next one's different. Inside your cheek for your DNA. Not for his. Treats gonorrhea, then pills for chlamydia and trichomonas. After contraception.
She has an IUD.
Over 99% effective, not 100. We still offer exposure prophylaxis. 28 days as soon as you start. I'm pretty sure they could use an extra set of hands out there.
It's nice to meet you, Alana. You're a very brave woman.
Yeah.
She's a good nurse.
She's still learning, but she will be.
After this, we're done?
Yeah.
I'm glad you were here today.
Me too. So the nurse examiner is supposed to lock up the rape kit in this fridge where it stays until it gets turned over to law enforcement. It's called preserving the chain of evidence. Are you fucking kidding me?
Is there a problem?
Jesus Christ. Police are supposed to pick up the rape kits within 72 hours. This one I did 2 weeks ago. God damn it. I got a rape kit sitting here for 2 weeks, so it's supposed to be picked up within 72 hours. I don't care. Get someone over here now. No. You expect us to treat your officers as soon as they come in? You get a detective to pick these kits up ASAP. I gotta go.
Dana, South 19 got their head CT before he went down. No results yet.
All right, let's send a reminder.
Hey, Dana.
Hang on. What's up?
We put in an order for more pain meds for Roxy.
All right, so put it in the nursing racks.
Oh, I did. A long time ago.
All right, I'll bump it to the front.
Thank you.
Dana, Chem 7's not back on trauma 2 yet.
Let me see the chart. Ah, Jesus, bet your Chem 7 rec went to radiology. Larry, Antoine, you put labs and chest x-ray on the same downtime for me. You need 2 slips. One. I'm thrilled to be here. You trying to text?
I am.
I was coming in this morning.
That was the plan. I guess you got.
Oh, Princess. Asking you shall receive normal head CT.
Thanks, I'll get him discharged.
Excuse me.
Yes, what can I do for you?
My wife and I were in an accident. She's in surgery right now. Would you mind holding my phone up for me so I could record a message for her?
Of course I will. Happy to. Oh, good. I have the same one. I know how this works. Ready?
Both so angry.
Hey, I'm sending Mrs. Kovalenko home with burn dressing, but not before she turned my sabbatical into a midlife crisis.
No comment.
Wound check, 2 days.
Got it.
What about Kylie, this little girl? She gone up yet?
Hopefully soon.
Hey, we're starting to clear some space around here.
Yep. PTMC charge nurse, go ahead, medic command. Is this a drill? Is this a joke? It's the 4th of fucking July. Got it. Thanks.
What's up?
Westbridge has a code black and is closing to internal disaster. Central's diverting all their ambulance. Top of chemistries and serology. Never had.
Thank God.
Hop one on. I won't take it without your initials, time, and date drawn. How are your initials, time, and date? Shit. Environmental to north. I'm on a budget. Take it or leave it.
My day is not turning out the way that I expected.
We had a call out. Langdon was available.
I was sort of hoping to be on my sabbatical when he came back.
You two were very close. Maybe this is the universe's way of telling you it's time to clear the air.
Maybe it is. Maybe it isn't.
Peter Aubrey's epic 4th of July party. Come on now, hey. Brats and brew. You are the man.
Appreciate the bromance over here, but no food, because you might go into surgery. No beer, because we're a goddamn hospital.
The diagnosis of aortic aneurysm or dissection, but the point of care ultrasound was
Done with that good luck, Granny?
ordered an acute abdominal series to rule out obstruction, still waiting on the x-ray.
Great, then you're free to shoot our latest and greatest in SAS 16.
Oh, come on, Dee. It's like every time I get a moment to chart, I barely get a sentence out before I get
interrupted. Sucks to be you, but trust me, it sucks worse for the poor gal in 16.
I'm beginning to think you enjoy torturing me.
Perks of the job. Probably let's go to the water park.
Those places are cesspools.
It's in the choir.
If she's feeling fine on Zofran, she's good to go.
All right, Louis in South 15. Meds are coming down. Another couple hours of monitoring, and he can broom.
Straight to the liquor store.
Don't pass go.
What about...
Asking for your opinion.
Thank you, Perla. Somebody down here has a little faith in me.
You know what motorcycle Mike sabbatical's really about?
Never try to guess what's going on in that head of his.
3 months being on the open road by himself. Man can't stand to be alone for more than a few hours. He sleeps with the TV on in his bedroom.
I really don't think I needed to know that. Maybe he's looking for something new. They're trying to outrun some old ghosts.
I hope he finds what he's looking for. Man deserves some peace.
Amen.
I consider the diagnosis.
Did you bring Langdon back here?
No, Al Hashimi did. You banished him to Scott. Great. If you ignore the hot mess and chairs.
Any update on our little baby Jane Doe?
Security's reviewing the CCTV from last night and this morning. You two kiss and make up yet?
I think someone needs to smoke a cigarette.
Trying to quit.
Why don't you quit when I'm on my...
This way. Haven't seen you guys in a hot minute.
Pick up from SCI Jones Force. Supposed to go to Westbridge, but got diverted to you.
Yeah, you and everybody else.
Princess, I need you to pivot to Central 9.
Got it.
Gus Varney, 54.
This of aortic aneurysm or dissection.
Got a new one for you in 13.
I'm 20 charts behind, and the new attending is threatening to make me repeat a year if I can't catch up.
Crimea River, old lady with bad abdominal pain. Somebody's got to see her.
Dana, please do me a solid.
Holiday weekend. Westbridge is down in our waiting rooms on overdrive. I'm sorry, but your charting's going to have to wait until after you're shipped. Ogilvy. Best I can do.
The man is in his element.
What's he doing?
An age-old ritual meant to capitalize off the unknown origins of Westbridge's current state of affairs. Whoever guesses the reason they went code black wins a pot.
Ah, interesting. We didn't do this at the VA.
Come on, we have people to take care of. You want to bring Langdon back from triage for the extra hand? You're the boss. From Westbridge already, chest pain and belly pain. Robbie wants you 3 out back.
Thank you.
Come on.
Dr. Santos.